Hey, hello everyone, and welcome to yet another Two Talk with Your Dentist on thedentaire.com. I'm Dr. Rekha, and the Two Talk with Your Dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your oral and dental health. Do subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, and on Telegram. And in conversation with me today on the Two Talk, I have Dr. Ranjani Rao. To give you a brief introduction about Dr. Ranjini. Dr. Ranjani Rao is a graduate from the prestigious RV Dental College and Hospital in Bangalore. Passing out in the year 2000, she has a rich clinical experience of 19 years in the field. She has an MPhil in Hospital and Health Management from BITS Pilani, with a fellowship in orthodontics and surgery and a mastership in implant dentistry. Dr. Rao is passionate about implant and aesthetic dentistry. Dr. Ranjini, along with Dr. Hema, manages two state-of-the-art dental practices in Electronic City, Bangalore. Dr. Ranjini, thank you so much for joining me today in today's Talk conversation.
Pleasure. It's so nice to be back here, Dr. Rekha. Thank you so much.
Yeah. So, what is it that you would like to share with our viewers today?
Well, I mean, no prizes for guessing. The whole world is talking about it, and I thought it's only apt that we give our 2 cents at this point. We're talking about the outbreak of the pandemic of COVID, or the coronavirus, and the new strain of it, which is known as COVID-19. I thought we should tell our patients things that we are doing in order to keep them safe when they come to the dental practice, and a few pointers for them when they come to the practice, so that the doctors, the staff at the clinic, as well as our patients, can do their bit to prevent this from spreading.
Yes.
So it's important for us to understand that we cannot shut down medical services for extended period of time.
Yes.
It's also our moral responsibility to keep the dental clinics going, even at the risk of exposure. Having said that, there are plenty of protocols which are in place, and I thought we should talk a little bit in detail about it.
Yes. So first of all, who would you want to address the issue to? You want to tell our patients the kind of precautions they should take, the kind of
Yes, I think what we should tell them is things that we have already done and how they can cooperate with us in it. For example, most of us dental centers have taken hygiene to the next level. Protocols have been made stringent. There is more frequent disinfection of surfaces. Please bear with us. We've removed all kinds of reading material, anything that can transmit or cause contamination. So you may not find newspapers, magazines, books, tablets, phones in our reception. We also advise you, if you're coming in for a short treatment, kindly leave your mobile phones, laptops, and all of that at home and come. That way, you're preventing that much of contamination from happening. In fact, we've gone a step further. Even our patient record forms, we are not giving it to the patient to fill up. We are asking the patient to tell us, and we will fill it. This is all being done for your safety, so that there is no cross-contamination happening. One. Second, every clinic is having a hand sanitizer at the reception itself. So what we advise y'all, make sure that y'all wash your hands at home before you come. Once you come in, please sanitize your hands. These are just simple steps that can go a long way in preventing contamination. Thirdly, all our dental chairs, entire equipment is being disinfected after every patient. Even if we've just spoken to the patient on the chair, the fact that the patient sat and got up, we have to clean and disinfect. You are going to see a slightly more number of disposables being used, because we feel that's the easiest way for us to limit contamination. So even though I'm a huge advocate of using less and less plastic and less disposable stuff, we've put that on hold for the next few days, because this crisis deserves certain extreme measures from our side. Also, I want to tell our patients, do not bring family members to the clinic unless they have to come. So if you're getting treatment done, kindly come alone if it's possible. But if it is your child and it is an emergency, then just one attendant. Okay. In fact, I have stopped allowing attendants and family members from coming into the surgery. Please understand, this is for your own safety. and it is for the safety of my staff members, so that lesser the number of people that come in contact, lesser the contamination. I know the easiest thing for people to say is, "Hey, why don't you just shut down your clinic?" What is going to happen? There are two things. One is medical services have to run. People are going to have health issues and tooth, tooth issues which need attention. Secondly, please understand we dentists are very small time, medium entrepreneurs. There is an economic and a financial aspect of it. I'm not saying that is the most important thing, but I think you should empathize with that aspect also. Then, when we come to the actual procedure itself, we are actually asking every patient to gargle with povidone or iodine and chlorhexidine before we begin treatment. There's enough reports that suggest that this can prevent any kind of, if there are any germs present on the surface, then it kills. Most importantly, as soon as you enter the reception, you're going to be given a new form that will talk about your recent travel history, yours and your family members. So I'm going to urge everybody in Bangalore City and all over who are listening, please be honest, forthright with your information. If you had family members, guests who are returning from any part of the world, please make that known, because that'll go a long way in containing all of this.
Yes. Okay. In understanding that there has been a history and the precaution is required.
Yeah, exactly. So if yes, there are. If you are a senior citizen, if you're above 60 years of age, if you also have pre-existing medical conditions, then I humbly urge you, if it's not an emergency procedure, please postpone. It's not worth the risk.
Yes.
Unless you're in severe pain, unless there is an acute infection, there is a root canal that is half completed. Only in these conditions, we advise you to come over to the practice. And even if you come, we will take extra care. Please let us know that you have medical conditions. If not, if it is your parents, anybody who is 60 and above, if it is not an emergency procedure, postpone indefinitely. Let's just wait for the situation to come under control, and we can proceed from there on.
So, Dr. Ranjini, anything more specifically that you would like to tell, the kind of precautions that we would take as such during a dental procedure?
Yes, ma'am. Because there's a lot of aerosol and all of that contamination, we dentists are taking double the precautions. So after every procedure, my entire suction units, all my equipments, sodium hypochlorite is run through it in order to decontaminate the medical with the pipes, because you can't make the pipes disposable. Of course, the suction tips are disposable. We've made all the handlers and the handling staff protect themselves. There are going to be masks. Of course, we're using filter masks. We're also using face shields, okay, and disposable aprons. A, to protect ourselves, B, so that we do not cross-contaminate, for both reasons. So those precautions are being taken. And as and when we get new directives, or at some point if we get a directive that we will have to discontinue medical services, then we will just have to abide by those rules. But at this point, the dental associations as well as the government has clearly said that we are allowed to continue practice and practice at highest sanitation levels.
Yes. So that was very useful information, Dr. Ranjini. I hope that will be helpful to all our patients, and I really hope even they'll cooperate with us in case we are taking more time for a particular patient because the in between time is taken to disinfect the dental operatory. And of course, unless it's not an emergency, I think it's best to postpone any of the dental treatments. And of course, like you said, the precautions that's been going on everywhere in the social media and in the print media and everywhere. And I think people are being made more and more aware that precautions they have to take. So
I urge everybody to please be aware, be alert, but do not panic. Panic is not going to help us in any way. One important thing that I forgot to mention, Dr. Rekha, I have started requesting each of my patients to carry their own water bottle from home. That is one of the simplest ways I can avoid, even though we use disposable glasses. But I'm saying these are tiny things, but will go a long way in. Also, the patient comes back relieved, knowing that he has exposed himself that much less. And you're right. Between two patients, the amount of time we now require to prepare a surgery is almost doubled. So I urge everybody to be a little more patient. I think this is the time for all of us to,
Yes.
kind of slow down
Yes.
and take this in the right spirit. If something good can come out of this
Yes.
exercise,
Yes.
then I hope it is that we all slow down the pace of our life and respect nature a little more.
Yes.
Yeah, so
Yes.
I just wish and hope all of you stay healthy, and assure you that we dentists are working very
Yes.
hard to make sure that we do not in any way cause any harm to your health, and try and keep the coronavirus away as far as possible. Thank you
Yes.
very much.
Yes. Thank you. Thank you so much, Dr. Ranjini, for joining us today and sharing your experience and all the precautions tips to our patients today. That was Dr. Ranjani Rao, who did talk to us about the precautions that would be required in a dental operatory, both from the patient's end and from the operator's end. I hope that was helpful. In case you people have any queries, please do leave a comment in the section below and do let us know. Until next time that I come back with another dentist with another topic on your own and dental health, keep smiling and be happy. Thank you.